Transcutaneous pacing is the use of electrical stimulation from electrode pads placed on the chest to induce cardiac depolarization. Transcutaneous pacing is indicated in the treatment of hemodynamically compromising bradycardias, including sinus bradycardia and high-degree atrioventricular blocks. The technique may also be attempted early in the treatment of asystolic cardiac arrest, although it is usually unsuccessful in this setting. Many bradydysrhythmias may be treated with atropine administration. If indicated, this treatment should be pursued prior to the commencement of pacing. Transvenous pacing may be used instead of transcutaneous pacing if the equipment and appropriately trained personnel are available. The technique of emergency transvenous pacing is covered in a separate chapter. Prior to pacing, place the patient on oxygen and establish an intravenous line. Expose the patient's chest so that the monitor leads and pacing pads may be easily attached. First, place the monitor leads on the patient. The white electrode is placed on the right chest just below the clavicle, the black electrode is placed on the left chest, and the red electrode is placed at the left anterior axillary line below the left breast. Next, apply the pacing pads in the anterior-posterior position if possible. Place the anterior pad to the left of the sternum below the left breast, and the posterior pad on the back just below the inferior pole of the left scapula. Anterior lateral positioning may be used alternatively. Place the anterior pad to the right of the sternal margin at the second or third intercostal space, and the lateral pad in the left mid-axillary line at the fourth or fifth intercostal space. Attach the cable from the pacing pads to the monitor cable. Turn on the monitor and confirm the presence of a bradydysrhythmia. Transcutaneous pacing may be uncomfortable for the patient, and if the clinical situation allows, consider the use of intravenous sedatives or analgesics prior to the procedure. First, turn on the pacemaker by depressing the pacer button. An indicator light will illuminate on the pacer button, and the monitor will display blips on the QRS complexes, showing that the machine is sensing the patient's intrinsic rhythm. The QRS blips will appear only if the pacemaker is in demand mode, which is the default setting on most transcutaneous pacemakers. Demand mode is preferable and safer than fixed mode pacing, since it prevents discharge during myocardial repolarization, which may cause ventricular fibrillation or tachycardia. The process of selecting fixed mode pacing varies by manufacturer and is not covered in this video. Next, select the pacemaker rate by pressing the rate button. The selected rate will be shown on the monitor screen. In general, the pacing rate should be set to 20 beats per minute faster than the patient's intrinsic rate. In cases of asystole, set the rate to 100. Next, begin to increase the pacemaker output by pressing the current button. Once the current is raised above 0 milliamps, pacemaker spikes will be seen on the rhythm strip. Initially, the spikes will not be followed by a QRS complex, indicating that electrical capture has not yet occurred. Continue to increase the output by 10 milliamp increments, carefully watching the tracing for evidence of electrical capture. Note here that electrical capture has occurred at an output of 80 milliamps. Each pacing spike is followed by a wide QRS complex. At this point, try to decrease the output in 5 milliamp increments to find the lowest possible current required to maintain electrical capture. In this case, decreasing the current to 75 milliamps results in intermittent capture, indicated by the presence of some pacemaker spikes not associated with a QRS complex. When the current is adjusted back to 80 milliamps, consistent electrical capture returns, and the pacer should be left at this setting. Once electrical capture is achieved, reevaluate the patient. Check for mechanical capture by comparing the pulse rate to the rhythm strip. Assess for patient tolerance of transcutaneous pacing, and consider the use of anxiolytics or analgesics. For additional information, including troubleshooting tips, please refer to the written portion of this chapter.